This is the future of Africa. In this program, we focus on Horn of Africa's political, economic, and socio-cultural aspects. Let's share our vision, hopes, and professional critics. All views are stemmed. Stay with us. Dr. Nuruddin, welcome to this program.
Professor Hussein, thank you so much. I am very humble and I am I don't have a word to say that I'm in your program. This is, to me, is a lot, and I appreciate you for giving me an opportunity.
Great. It's an honor to have you here. Dr. Nuruddin is currently serving as a president of International Oromo Health Professionals Association. We'll be discussing a number of issues with Dr. Nuruddin. And to start with, Dr. Nuruddin, tell us a bit about the International Oromo Health Professionals Association, how and why it was established, perhaps its vision, missions, and objectives.
Thank you so much. As IHOPA, which is International Oromo Health Professional Association, is an organization that includes every healthcare aspect. Some people, they misunderstand it as physician-only doctors, but it is all healthcare professionals are included in this organization. The history behind of this organization, an individual health professional, they were doing first aid at OSFANA, Oromo Soccer Federation. They were doing a volunteer, and from there, in 2016 in November, they all came together, including me. We were talked about how we can work on healthcare of Oromia, over here too, how we can minimize the problems. So based on that, on 2016 in November, we talked about it, that we need an organization, a healthcare organization, and we need to form that organization. Then in 2017 in May, IHOPA is officially inaugurated in Chicago, having a board, an executive, and bylaw, and all of that. The history of those individuals, there are many of them. I don't want to mention one and leave the other one, but history will tell. There are those who started this idea, and now IHOPA is here. As far as mission, like you say, IHOPA is a non-profit organization whose mission is to address the healthcare needs of the Oromo people, others in Oromia, diaspora, and beyond. We do that beyond through, like I say, by doing assessment, identification of cares of healthcare improvement, thereby contribute the promotion of quality healthcare, including like preventative care. We're going to do exchange of knowledge, skills, and also appropriate technology. By doing this, we are going to accomplish the mission. As far as the vision is, IHOPA's vision is to expand the base of our Oromo Health Professionals network and accelerate its effect in alleviating the healthcare disparities in Oromia and the Western nation. That means IHOPA is going to be the bridge for both to close that disparity that's happened in healthcare. This is a nutshell. I put it back for you.
Great, thanks so much. We'll be talking about the details of what we are doing in Oromia, but in general terms, what major activities are you doing now in general terms before going to the specifics of the Oromia context?
We have done so many things before, but currently we are working on two things. We are working on IDP, which is internally displaced people of Walega. Those are it can be through so many things that happen. And we are working on famine that is going on in Borana and Guji. But the famine, even though we are focusing on this, but the famine is all over. It's in RC, it was also in Bale, it's also in Hararge, it's Tomai. There's about 12 million people is affected. But right now we are focusing on two things. And we are doing this with our sister partner in Oromia, which is OPA, Oromo Physician Association. They are on the ground. They have clusters all over Oromia. So everything that we do, we collaborate with them. We are doing together.
Thanks so much. Well, I personally understand that you have been providing support back home, working with a number of health institutions, particularly in Oromia. What specific professional supports are you providing back home?
We did in December, we brought a mental health week that is as a collaboration between Oromia, between Haramaya University, University of Minnesota, and the AMACA, which is African Middle East, as an institution, I think as an organization with IHOPA together. We went totally about 11 people. We went to Oromia University. We did a mental health week teaching. That thing is still going because we connected Haramaya University with University of Minnesota. So they are still doing a meeting. In the future, they're going to do research. There's so many things that is going. And there is another one, upper GI screening. That is Dr. Abashamo and Dr. Malik. They were in Oromia. They just came back. That is going to be a cancer screening that's going to happen around RC, Shashamane, Nepal, and all that area because the upper GI cancer is being shown up a lot over there. So that is really the major one we are going to do because that project brought us together with the federal ministry, which is with the Dr. Leah. So they, Abashamo and Dr. Abashamo and Dr. Malik, they pulled up IHOPA to the federal level. Now we are going, now if you mention IHOPA in Oromia, everybody knows that. That's the big project we are going to do because the screening of upper GI wasn't done. It was, even if it's done, it's very little, but now they are going to teach, and they will talk about it a lot. I think they're coming to a program to tell what is going to happen.
Great, that seems a great achievement. And
I don't want to kill their hard working, so I'm going to leave it that for them.
Sure. Well, I personally, again, disclaim that the health sector in general and the provision of health services in particular have been challenged by a web of complicated factors in that country, in Ethiopia and Oromia in particular. Well, in this regard, what major or key challenges did you observe so far? And I think you are taking up even from Oromia to the level of the federal government. What do you think are the major challenges of the health sector in that country?
I think when I was, before Professor Hussein, when I go to Ethiopia or Oromia, I went twice. One time I went for a hospital project where I born, the city that I born in Chiro. But the second time I went to visit family, but I never seen in depth what the problem was before. But this time when I went, because I went for a project for that project, and at the same time I went around and looked what the problem of the healthcare in that country. Some of the thing I saw is lack of available foreign exchange market for the private sector. Because there is no foreign, the government will not allow the foreign sector. So there is no, if they allow them, they will bring medicine, they will bring equipment, which is good, but there is no foreign exchange. So that is one of the biggest problem I saw. The second problem that I saw is the inflation. The inflation is like every minute it changes. So the price of the medication is up, the price of everything is overwhelmed. So because of the price is overwhelmed and because of the price of shortage of medication, people start doing what? To start using traditional medicines. And then the other thing I saw is people not having a knowledge or awareness about the healthcare, about their disease, and instead of things that you can catch it on a screening level, that things go up to the measure and they end up in big crisis. So the other really surprised me the most is really if elected officials, high-ranking governments, and rich people are going to India, are going to Dubai, are going to China, Thailand, even US, that tells you you're not even trusting your own system. That tells you the system is failed. And then what is amazing, because I was asking around, the number is going every year. The number of people who are seeking treatment outside of Ethiopia is going up every year. So that it tells you the whole system of the healthcare is not working.
Thanks so much,
So
Doctor.
on top of it,
As
if
I
you on top of it, if you add, if you on top of it, the number of hospitals in Finfinne, very small. The population is so high, and then the healthcare professional, they overworked, underpriced, and then also disrespected. That shows you they don't have no moral to work. If they don't have no moral to work, they're not effective. That is going to hurt the healthcare system at all. So that is all our chain that are connected. So the crisis is not only one point that you can pinpoint, is everywhere, is add up. They're adding up everything. So that is what it is.
Great, thanks so much. As I try to describe it, the health sector and the health provision or health service in that country is characterized by a number of challenges. Actually, I said web of complicated factors, and you are telling us some of the challenges. Let's single out one critical challenge that I know, and in fact, many people argue that there are quite a lot of ethical problems in providing health service in that country, in Ethiopia in general, and in Oromia, if you like. And do you agree with that spat or argument? And if yes, what do you think should be made to elevate such critical problems? Because health services should be very ethical as far as I'm concerned.
Absolutely. I have seen it. It's not like I heard it, but I have seen it. Some of the problem I can tell you is the healthcare, like the doctor, the healthcare providers are afraid of to treat someone because he's an opposition party. That's unethical. As healthcare is a universal, you have to treat no matter who they are. So you have to treat no matter who they are, what kind of political affiliation they have, just because they are opposition party, or just because they are against your view, against your stand, that the physicians are afraid to treat that person. The physician are afraid to write a referral letter for that person because the consequence is that, because they can end up in jail. I know a doctor who ended up in jail that we communicate to the area, and then later on got released. This is unethical. What I mean, as a healthcare professional, you shouldn't be worried about a person's political view, religion, whatever. You just need to. That is one thing that I've seen a problem. Second, in those people who was elected at the hospital level, on the top level, they are, for you to get that status, first of all, you have to be a part of that party. You have to be a member of that party. And the member of that party is the ruling party.
Yeah.
So that means the interest is right there. It tells you are there just to fulfill what the current government is saying. Is not and you're not independent. What I'm trying to say, as a healthcare, you are, and as a healthcare is universal. One is universal. Two, as a healthcare, you are non-profit. You are doing it without that precondition what I told you. But at this scenario, if your boss is appointed by the government, all you have to do what he tells you. You're not going to do what you learn, or all of that is gone. This is unethical. The other thing, like I told you, nepotism, favoring someone. Someone is not qualified in a position. He's not qualified, but he's in that position because he knows somebody, or he is part of somebody. Those is the thing. And then the other one is corruption. I don't want to talk about corruption in Oromia because, that is it's been there in Ethiopia. So I don't want to talk something that I'm not going to make any difference, because there is a systemic problem that needs a lot. So as far as you say the solution, I want to say, as far as the solution that I came up with is a dialogue, discussion, because talking from outside negative things to the government is, I've seen it, I've done it before, and I say we need to stop that. So we need to do, even if we get 50%, out of 150% of the people, if we take care of the people, that is a good thing. So the only thing is we can do this is by dialogue. Dialogue with the government, sit down and talk, tell them that we are a non-profit organization. We are trying to help the healthcare of our people. And at the meantime, also do tangible thing on the ground. And instead of talking too much, build a hospital, build a clinic, do something that the community, that makes a difference in the community's life. Then you will get a trust from the community, from the people. Then you can push the government. You can say, can you loosen up a little bit here? Can we get this? Can we get this done? That is the only thing I can come up at this time, because I have for 25 years before I became, I think, more change, I've been talking negative. I think this is the way out from the problem. Dialogue, talk, do something on the ground, show tangible change like we did right now, with the Oromia University, with the GI upper screening, with the COVID that we did. The COVID, we spent a lot of money. We gave education formula all the way to Oromia. Put the brand IHOPA everywhere with OPA, that we are there to change the healthcare of that country. Then you can at least you can negotiate. You take it, give and take. The world is give and take anyway. Then we can sit down and talk.
Thanks so much, Doctor. Yes, some of the critical services like education and health should not be politicized for any reason. I do agree with that. Let's go better deep into the critical challenges of that country, particularly Oromia. As you know, currently there are a lot of challenges, the turbulences, if you like. We can mention war, inflation, drought, starvation, and a lot of displacements. Undeniably, such situations worsen the problem of health and the provision of health services. How do you observe this in general terms? Is it possible to provide health services amid this kind of turbulences?
To be honest with you, it's very hard, because we have seen it that our partner OPA was going to do like IDP places. That is, the IDP people never talked about. We are right now focusing more on the payment, but if you see, as millions of people are displaced from there. This situation is not from the drought. This is from the conflicts of man-made. So this can be stopped. Something can be stopped. So the IDP places is very hard, because when a lot of people sit in one place, there's so many communicable disease, so many issues. It became hard. Not only that, even to reach to some areas, the security, you don't know who's in that area. So that's why even if you see the foreigners with the NGOs and the other ones are not going to that place, because nobody's taking their safety there, and the government is saying, hey, I don't know. Everybody's like, so the only some individuals like OPA are going, but is because due to safety, there's areas that not be reached till now. So this is hard for healthcare, to do healthcare service in that area. This is making it very worse. And on top of it now, the inflation. And when every day is going up, so there's people cannot afford to buy medicine. That's another issue.
Yep.
And then the drought has been there for 3-4 years. That is another issue. So many things happening at one time. When the drought happened, when famine happened at the same time, disease also comes with it. The same thing is happening in the Borana area too. So the situation right now is very hard for healthcare providers to help people. That's why I am really advocating for international world to step in and to do something, because it is not 10 or 20, 30 people. We are talking about millions of people. They are not even back to their place. They are still IDP. There are some of them like going through a lot. So this is the area, to be honest, we all Oromos, especially in diasporas, that's what I'm asking, to advocate, because if you don't advocate, nobody will advocate for our people. It's our time for us as a community, as a religion leaders, as an organization, as individuals, to write a letter to all USAID, NGOs, to all this and say what is going on, because the story is not coming from there. The story is not. So we have to tell the story to the world, what is happening in Oromia.
I think I've been observing that you have been advocating this aggressively. Actually, I've seen your talks and presentations, specifically in relation to what's happening in Borno and other parts of Oromia. And in general terms, as a professional, as a concerned person, what do you advise the government of Ethiopia, the Oromo people, and the international community as a whole?
For Oromo people, let me address the Oromo people who's hearing this broadcast. This is the time for us. The Oromia is going through a lot of challenge. The Oromo people and our mother Oromia is going through a lot of challenge. This is the time we need to minimize our differences. We all have differences, but this is not the time we magnify little thing and fight. This is the time we come together and talk about the fate of our people, the fate of the country, what we have to do. What is our job as an individual, as a community, as a leader? We all need to sit down and talk, because our unity is the number one strength. Our unity is the number one strength. If we become united, we can solve this problem that's happening in our country. We can solve everything. But if we go individually, we run, at the end of the day, what we do is not going to be effective. One. Two, the magnitude of that problem is not even told. It's big. It's 12 to 20 million people are starving. This is not simple. Mm-hmm. It's not simple. This is not Ethiopian government or the Oromos in diaspora or rich people can solve this problem. This is the international world in need. Sure. So we need to come together, leave alone everything aside, put the priority, what is number one at this time, what we have to do. Put the priority and then have consistency, not one day, and then the next day gone. No, put consistency with discipline. If we do it every day, we can make a difference. So this is for the Oromo people, for my people. And I'm begging them, I'm telling them, I've been yelling, it's been past 2 months, I've been coming on media and saying, come on. Because the problem never been told. A drought was a 3-year drought. Like I say, the IDPs, no one is talking about it. Their story are not coming out. For some reason, the story is suppressed. We all know that. The international media, even the country's media is not. They start talking about it now because we're pushed. They were not talking about it. So it's up to us to tell the world the story. It's up to us to come together and to find the solution, because we can solve our own problem with our own people. That is, I believe. For the government I'm telling the government, pushing hard never solve a problem. We cannot solve a war by war. That doesn't work. You solve a problem with a solution. How you solve? They need to open up. They need to sit down and dialogue. 1, 2, they need to stop saying they are the only one, the solution for that country. When you say you are the only one, that means you are excluding the rest of the people. People with rebellious, they're going to come to you. So you're not the only one. So they need to call all opposition party, all stakeholders. If they want that country to be peaceful and prosper, that is the only solution. If you say I am, that means you're a macho man. We've seen it before. It didn't work on TPLF. It didn't work in Mengistu. It's not going to work on this one too. The only way it's going to work is dialogue. Sit down and talk, minimize our difference, negotiate. All right? Then the country will change. The people will smell the peace. The people never talk. We never talk about war. We need to stop talking about war and all that thing if we do this. So I'm telling you, the international world is up to us. Because if you don't tell them the story, they're not going to come to your house. It's our job to knock everybody's door and tell that our people are dying, our people are suffering, our people are starving. Is our job. So once we put a pressure to international world, they're going to step up. They're going to do their job. If we don't do it, that's not their problem. So the international order can be solved, we solve it. We need to be advocate. The Ethiopian government, I already say about it. The Oromo people, our strength is our unity. Let's use our unity and let's come together and put aside all differences. Let's bring the interest of the Oromo people first, not your agenda. I have, as a Nureddin, I have my own agenda. But my interest of the people is better than me, is bigger than me, my own agenda. So we need to put aside that and think for these people. These people are dying, leaving their country. They're going through much, All of my life, all I know about Oromo is miserable. But the story is so bad. So we need to change that narrative to a good one.
Thank you so much, Doctor. Let me ask you one question, and perhaps let me challenge you. As the current president of International Oromo Health Professionals Association, what's your vision? Where do you want to take this organization during your term? I know that there are a number of high-level professionals who are members of this organization. Yes. You have that kind of support, and I also see the possibility of expanding, enlarging it to, again, to the next level. And what's your dream in your term?
That's a good question. To be honest with you, this organization just started in 2017. It's like 5 years something. But there's a people within this. It's not me. There's people. You see what the thing is? In this organization, there's people behind it. You see Sule front, but there is a strong, determined, dedicated people behind this organization. So this organization have done, like I say, what we did what we did before. Just within this 2 months, we raised about almost 60,000. And what we raised, 35,000 is already gone, and the other one is gone. It's going to go soon, within next month. So the only organization, Oromo organization, at this time that's doing on the ground with this much resources, IHOPA. If I say that, I'm not exaggerating. I'm telling the truth. So what I want, IHOPA, is to be as lit, just like USAID, other NGOs. The reason I said it because I have 65 million people behind me. If they all support their organization, there's no reason it's not going to be like USAID or other NGOs. We can do anything we can if we come together, if we work together. So IHOPA, I'm taking the IHOPA to the second, even if I don't do it in my term, but it will be. Not only is going to be in Oromia, it's going to be in Africa, it's going to be in the world. The headquarters is in Minnesota. That means we already have the US base. So what we're going to do, expand it with our partner in OPA, Oromo Physician Association, even other organizations, they come together. So we have to notch it up, challenge the world, not only in the local. We've got to come outside that and then be the healthcare, not only Oromia, the healthcare of the world. We can be. There's nothing limit. The only thing that you limit yourself. If we limit ourselves, we say, oh, here, we are there. But if we open it up, we can do it. I guarantee you there's a lot of brilliant people behind me on the board, on the executive. Not only brilliant, they do actions. Not only action, they give what they have. They never say no to IHOPA. Every time I ask, hey, our people need help, they are there. Every time meeting, they are there. They're committed. That is the only one, I think, what makes IHOPA different is if you see other organizations, I'm not trying to belittle Professor Hussein. I'm just saying what makes IHOPA different, because in a healthcare organization, it believes in action. It's not like yearly you come on a meeting, you do presentation and you go. No, IHOPA is do action on the ground because it's healthcare. So because we are doing action on the ground, we are growing up every year. Every year we are becoming better from the last year. So I see IHOPA not only in Africa, in the world.
That's great vision, great energy, and great dream for that matter. Congratulations for that vision. And let me give you opportunity to make some kind of final remark in a split of second, if you wish.
All right. Thank you. First of all, thank you for giving me an opportunity. Professor Hussein, I was watching you from Johns Creek when you were in Oromia debating about the Madammer book. And I was saying, oh man, Oromia has what a smart and a brilliant professor in Oromia, and suddenly I saw you end up in Little Oromia. So the irony, the world will change every 5 minutes, not only the inflation. So that's what it is. And I appreciate that you gave me a chance. But one thing I want to mention here is for my people. Things that we do on organization level is very strong. It's very effective, and it's also it has value, and is, so I want my people to challenge. Let's come up with individual things and do things on organization level. So as I hope, we just 2017 inaugurated. We have done so much. Just this past 2 years, I'm repeating back, $60,000. I hope is going to allocate. It's already allocated $35,000 for IDP and Borana Femen, and there is another one now. We are also coming. So it's total of 60,000 in 2 months. That's the only Oromo organization that have done this. So, what I'm not promoting this to sell it, but what I'm telling you, things that we do as an organization are very strong. And then anywhere we go, we can say we have done this, and then we can say also what? We can negotiate. We cannot go an empty-handed back home. So what my point at the end of the day, please go to our website, ihopa.org, check what you have done so far, and then be part of this organization. This is your organization for you, so support this organization. At the meantime, for the Diaspora Oromo, we are also a model. So a kid that born in Chiro, raised in Finfinne, and lived in Atlanta, became a doctor, a pharmacist, as a motivation for kids who was born in the West, and they say, oh, where are we gonna end up? Look at Sule born, English was not his first language. He came here from nowhere and become here. So you can do more. So we can be role model for your kids. We can give advice to our community. So I'm asking for the whole Oromos in diaspora to stand with IHOPA. Thank you so much. When I speak fast. That's the way I am. And I took
Thanks
that
so
from my
much,
dad.
Doctor. With this, we conclude our discussion today with Dr. Nuruddin on the current situation of Ethiopia and Oromia, particularly in relation to health and health services in that country. For those of you who like to share your vision, hopes, and professional ethics, the door is open. Please contact me through my Facebook. My name is Dr. Hussein Kadir. See you next time. Dr. Nuruddin, it's an honor to have you here. Profoundly thanks so much.
Thank you so much, and I appreciate you.
This is the future of Africa. In this program, we focus on Horn of Africa's political, economic, and socio-cultural aspects. Let's share our vision, hopes, and professional critics. All views are stemmed. Stay with us.